via the Jack Spring Electric Keel Newsmaker hotline. Back again today, United States Senator Dr. Bill Cassidy. Hey, Dr. Bill, welcome back to Keel. How you doing this morning?
I'm doing fantastic. How are you?
I hope you don't mind. There was something when we had you on last week that you had made reference to, and a lot of folks have asked me about this. We've gotten a few emails, etc. And I would hope that you would take a couple of seconds, a couple of moments, and clarify and explain to us what you meant. You were talking last week, and correct me if I misunderstood, and if our listeners misunderstood, you were talking about door-to-door mandatory testing in hotspot neighborhoods. A, is what I just said correct? If it's not, straighten us out. And what is it that you are in favor of?
It is not mandatory. It would be voluntary. But imagine this. You can go to the Louisiana Department of Health website, and you can go, you click on the COVID-19, you come up with a map of the state that shows the number of cases in each parish. You can then go down and click on a little arrow in the bottom right-hand corner of that map, go over 4 or 5 places, and it brings you to what is called a census tract map. You can zoom in, and you can find out that in Caddo Parish and Bossier Parish, there are specific census tracts, if you will, very large areas of neighborhoods in which you have more disease. Now, could you imagine that if you're in that neighborhood and you're at increased risk, maybe you have obesity, diabetes, or high blood pressure, wouldn't you want to know if you were positive? Wouldn't you want to know if your neighbor was positive? And if your neighbor was positive, wouldn't you want to be, or he want to be, given the option, not mandatory, but the option of having quarantine with food and doctors taking care of her or him for 2 weeks to make sure
Senator, you
she
can't
didn't
give out
die?
you can't give out my neighbor's information, can you?
You can't give it out. But, okay, so let's imagine the two of you live next to each other.
Okay.
And you're in one of these hotspots. You can go to this map, by the way. You can see where in Caddo and Bossier most of the cases are. And so if you're going to protect public health, you, on a voluntary basis, say, listen, can we test you? If you're positive, we're going to, you may live with 5 other people. Do you want to infect those 5 other people? If not, we're going to help you quarantine. Not mandatory. It's up to you. But if you want it, we'll test you if you want it. And we'll also, if you want it, we'll ask you to quarantine. By the way, because of that, you won't spread it to everybody else in your household. And if you don't spread it to the people in your household, maybe they won't spread it to your neighbors. And that's how you can't tamp down the disease. Okay. That's how you get Louisiana out of lockdown. You don't get Louisiana out of lockdown by saying, okay, everybody, we just hope it doesn't come back. You get Louisiana out of lockdown by saying, listen, this is where we think we have more disease. If on a voluntary basis we offer testing to people, make it easy. So if you are, 89 years old and you can't walk around, we'll come to you. You don't have to come to us. But in the meantime, your grandchildren and great-grandchildren will be protected. And by the way, because your great-grandchildren aren't getting infected, they won't give it to the kids next door who give it to their parents. That's how you get Louisiana out of lockdown. Okay. It's kind of crazy.
Pardon me, it was just a few days ago that meanwhile back here in Louisiana, right, we're on another 15 days, May 15th of quarantine. That was the governor's statement a couple of days ago. What do you think about that? Do you think weighing those two things, the economy versus another 15-day lockdown, what are your thoughts about the governor's move?
We have a choice. Either we do what I'm describing, where we figure out where more of the disease is, and on a voluntary basis, we ask people if they want to be tested, and we help them. We support them if they're positive until they are through with the disease, or we continue to have these kind of outbreaks, which necessitates these sort of lockdowns. Now, I actually think that if we did a focused sort of this is where it's hot, this is where we're going to therefore focus resources, and this is on a voluntary basis where we support people through this process, we get out of this lockdown a lot faster because we're not spreading disease. But if we just want to keep on writing checks and watching people go bankrupt, then we're going to be stuck in this pattern of where we think we have it under control, then it pops up, and maybe the governor decides we have to lock down after all. I think we could come out of lockdown if we have this sort of focused, voluntary effort.
Speaking of checks, you're working on a bipartisan plan to give help to state and local governments. We really need it here. How soon and how much money are you talking about?
Well, tell me how come you need it. Why do you need it?
Shreveport has lost so much tax revenue because the casinos are closed. People aren't spending money. There are all kinds of reasons. But is that what this money is for, or is it to pay for what you've spent fighting the virus?
There's already money to take care of what you spent fighting the virus. What you're describing is exactly what we're talking about. You have a small restaurant, a business, a restaurant. I've been to some of your restaurants down there. There's one, you got big LSU sign, got a Louisiana Tech sign, Northwestern sign. I like to go there, feel like I'm in a place. It's got a Saint sign instead of a Cowboy sign. I really like that.
Me too.
And so if I go there, we've been supporting that owner of that restaurant with these payroll protection plans. But if there's no police, no fire, no sanitation, that guy's going to close his doors. Period. End of story. So what we're trying to do is support cities as they maintain essential services, sanitation, fire, police, so these small businesses can reopen. All because they've lost sales tax revenue, hotel bed tax, airports have lost landing fees. The local government has taken a huge hit. If local government has to declare bankruptcy, they're going to lay off cops, firefighters, sanitation workers, small businesses close. It's an ecosystem. We're trying to support them.
Dr. Bill, if Louisiana, one of the smaller states, is in line to get, we talked about this last time, $1.8 billion from the federal government. We're one of the smaller states. There's 49 others. How much longer can the federal government just keep printing money and passing it out, trying to make everything okay?
Well, the alternative is the Great Depression. Now, I'm going to bring this conversation back to the beginning. We've got to figure out a better way to tamp down the disease, to save lives, but to control the virus and to reopen the economy. And that's what I've been pushing for. And that I'm going to go back to it. If on a voluntary basis you go into places that are a hot spot, those are the places you test and support people. On the other hand, if there's other areas that are just like no disease or very little, that's where you kind of do contact tracing. You're sick, therefore we're going to see everybody you've had contact with. And by the way, this is exactly the plan that President Trump's administration just came out with. Exactly the plan, except I'm putting granularity on it because you can go and find out in Bossier and in Caddo where you got disease. As a favor to those people, whoever lives there, it would be really nice if we could test, find out who's sick, protect them, and protect the people they live with.
We're hearing around the country stories about inmates being released from jail early. We know the former mayor of New Orleans was released early. We have a case here where a guy keeps getting sent out of jail and keeps breaking into businesses, arrested and let go. What are we going to do to stop that? I mean, what's the answer to that?
For one, if somebody is a serial offender or somebody's violent, they shouldn't be released. But you got to realize we're right now endangering the guards, the secretaries, the administrative workers, and their families. So Oakdale is a prison, Oakdale, Louisiana, federal prison. I don't know, like 20% of the guards and the staff are infected, and they're like giving it to their families, and maybe one of them died. Now, this is a place of white-collar criminals. Think the guy that did Medicaid fraud. He's not going to go out and shoot and rape. But in the meantime, a significant percentage of the prisoners are in the hospital. Guess who's paying for that? The public's paying for that. And so prisons are just a great place to spread coronavirus. So in an effort to protect the staff, the deputies, the sheriffs, the guards, the staff, you name it, President Trump's Attorney General, William Barr, has recommended releasing releasing criminals, but nonviolent. You can release Mayor Nagin of New Orleans and then put him back in the pokey in a month, and no harm, no foul. It's that sort of white-collar person that you would release. Now, I sent a letter saying, don't release the rapists, don't release the murderers, don't release the violent people. That's a threat to society even greater than the coronavirus is. So we want the Attorney General to be judicious about this. Okay, if you want to protect the guards, okay, I get it. The mayor of New Orleans, I get it. But in the meantime, protect the people. Don't release the people who are bad actors.